Welcome to our enlightening journey into wound care for the elderly. As we age, our skin becomes more delicate, making wound care a critical aspect of elder care. From accidental cuts to surgical incisions, wounds can occur for a myriad of reasons, and the aging process can complicate healing. First aid is a vital skill when dealing with wounds. It's about stopping the bleeding, cleaning the wound, applying antibiotic ointment, and covering the wound. And remember, if the wound is severe or shows signs of infection, don't hesitate to seek professional help. Chronic wounds, like diabetic foot ulcers or pressure sores, require ongoing attention. Regular inspections, proper skin care, and following doctor's instructions can make a world of difference. Recognizing signs of infection is crucial. Increased pain, swelling, redness, discharge, fever, or delayed healing are all red flags that warrant immediate medical attention. Wound care in the elderly is not just about healing. It's about preventing severe complications like infection or even amputation. Regular cleaning, changing dressings, following medication guidelines, monitoring for changes, and reaching out to healthcare professionals are all part of this essential care. In conclusion, understanding wound care for the elderly is a vital part of promoting healthy aging. By recognizing the importance of wound care, we can make a positive impact on the lives of our elderly loved ones, ensuring their comfort and happiness.
Well, that's all there is for this nugget. You can go on to the next fact or ask a question of your own. Just go to Ask a Question in the navigation and we'll answer any question you have about anything. And if you're not on our site, just go to nuggetstoKnow.com and you'll find everything there. Until next time, keep chasing your wildest dreams and uncovering new adventures.